Good morning, everyone. This meeting of the Baltimore City Council Health, Environment, and Technology Committee is now called to order. I am Danielle McCray, the councilwoman representing the 2nd District and also chair of the committee. In attendance today, we have Councilman John Bullock from the 9th District.
Thank you, Madam Chair.
Thank you. Councilman Mark Conway from the 4th District.
Thank you, Madam Chair.
Councilman Ryan Dorsey from the 3rd District.
Thank you, Madam Chair.
We also have Councilman James Torrance from the 7th District.
Thank you, Madam Chair.
Councilman Isaac Yitzi Schleifer from the 5th District. And not a member of the committee, but we are also joined by Councilwoman Odette Ramos from the 14th District.
Thank you, Madam Chair.
And also in attendance, we have Matthew Peters, staff to the committee. Before we get started, just a couple of ground rules. We're just asking that you please stay muted until you're recognized by the chair. Mute yourself when you are not speaking. Before you speak, please identify yourself, the agency or organization that you are with, and your position. Please speak slowly and clearly. After you are finished speaking, please mute yourself again until you are recognized by the chair. And we're just asking that committee members and city agency officials keep their video on for the duration of the hearing, unless you're experiencing any technical difficulties that prevent you from doing so. Last, for members of the public, there will be an opportunity for public testimony. You will have 2 minutes each for testimony. The committee has 2 hearings scheduled for today. The first is on Resolution 21-0071R, investigative hearing, developing a coordinated response to Baltimore City's overdose crisis. And the second is on Resolution 21-0069R, investigative hearing, well-being of the transgender community in Baltimore. We are going to start with Resolution 21-0071R for the purpose of requesting the Baltimore City Administrator, the Commissioner of the Baltimore City Health Department, the Commissioner of the Baltimore Police Department, the Chief of the Baltimore City Fire Department, the Director of the Mayor's Office of Performance and Innovation, the Director of the Mayor's Office of Neighborhood Safety and Engagement, the Director of the Mayor's Office of Emergency Management, and the Director of the Department of Finance to come before the Baltimore City Council to provide a comprehensive briefing on the city's coordinated response to the current overdose crisis. How can we develop and implement an RxStat work group with our local healthcare partners, the use of mobile safe injection sites, the allocation of funding to distribute fentanyl test strips, and an examination of the prevention, diversion, and rehabilitation programs we have in place to save lives. This hearing is going to start with brief opening remarks from the sponsor, which is myself. Then we're going to hear reports from the agencies and give committee members the opportunity to ask questions. After that, we will have a brief presentation from the Baltimore Harm Reduction Coalition, and then we're going to move on to public testimony. The opioid epidemic has plagued each neighborhood in our city, from the Frankfurt community, which I represent in Northeast Baltimore, to Emerson Village, where I grew up in West Baltimore. Our city saw 227 opioid-related intoxication fatalities in just the first quarter of this year. That was up from 8.6% from the first quarter in 2020. In 2020, our city lost a total of 1,028 lives to intoxication-related deaths. And between 2013 and 2019, our city saw a 271% increase in fatal overdoses. There is no sign of this epidemic slowing down. And that's why it is imperative that we convene to analyze existing data to evaluate the trajectory. We must look at how the epidemic is plaguing varying demographic cohorts and identify the intersectionality present. We must fully understand what our city's past and current initiatives are, along with our short and long-term goals. These pieces are crucial in order to curate innovative solutions and dispel current trends, because we know that addiction and overdoses are preventable, treatment exists, and recovery is possible. I am determined and ready to elevate this conversation so we can service our residents in the best way possible. We're going to hear from our agency representatives. And before I do also want to acknowledge some other folks because I missed a few people within the room. From the Council President's Office, we have Matt Stegman with us today. And from the Mayor's Office, and bear with me because the screen is a little small. Give me a second, guys. From the Mayor's Office, I'm not showing anyone at this time, but we'll double back once they join in. So right now,
It's Natasha Mayu, Director of Government Relations. I'm here on behalf of the Mayor's Office. Thank you.
okay. Okay, thank you, Natasha. I didn't see your face on the screen, and I'm working with a lot of folks in the grid. Thank you, Natasha, for being here. The
No
Mayor's
problem.
Office is present. So we're going to go ahead and move on to our agency representatives and committee members. I'm just asking that you hold your questions until we have heard from all of the agencies. We're going to start with the City Administrator's Office.
Madam Chair, on behalf of the City Administrator's Office, Natasha Mayu, on behalf of the Mayor's Office, the City Administrator Office is supportive of the presentation that will be provided by the Baltimore City Health Department and Behavioral Health Systems Baltimore and defers to their presentation.
Okay, is the BOE still taking place at this time, Natasha?
I'm not sure exactly, but I could circle back.
So I just want to let you know in the future, when we're requesting someone from, I can't speak for other committees, but when we're requesting someone on the HAC committee from the City Administrator's Office, we're looking to see someone. So if the City Administrator is unable to join us, then I would like for a representative to be present in the future. We're going to, and thank you, Natasha.
Understood.
And we're going to move on to the Health Department at this time. I understand that the Health Department also has a presentation.
Yes, thank you so much. This is Kelly Eastman, Deputy Chief of Staff with the Baltimore City Health Department. And we have Brittany Spencer, our Director of Opioid Overdose Prevention, and Adrian Bridenstine from Behavioral Health System Baltimore, who will be providing a presentation this morning. So Brittany, I'll turn it over to you.
Thank you so much, Kelly, and thank you, Madam Chairwoman. I am going to share my screen and start presentation. So my name is Brittany Spencer. I'm the Director of Opioid Overdose Prevention. And I thank you all for being here today to hear some of the initiatives that have been happening and that are still ongoing. So hopefully everybody can see my screen. Yep, okay. Okay, so some of the things that I wanted to cover in today's presentation is a few of our city stakeholder committees. So we have two of those. We have the opioid intervention team, and then we have the OFR, the local overdose fatality review team. Just to kind of take a little bit of a look into what the purpose of those are and what some of the initiatives are that have come out of those. Talk a little bit about our partnerships at the health department, funding, talk about our programs, and then give a little bit of an overview of what overdose prevention sites are, and then talk a little bit about opioid treatment providers and what the city health department's role is in those. So our opioid intervention team is comprised of government, medical, and community-based partners. It's really to help us focus new innovative initiatives and come up with those and how everybody can come together at the table to help combat the overdose deaths. So we are charged with the development of a citywide response. So recently in 2020, the end of 2020, December, we published a new strategic plan. We went through with a outside contractor to help us with the strategic plan. We intentionally focused it to kind of mirror what the governor's office has through the Opioid Operational Command Center, the OOCC. So those are three different buckets. Those are prevention and education, enforcement and public safety, and then treatment and recovery. So when we went through that strategic planning process, we wanted to make sure that it made sense for Baltimore City. So it is a 3-year plan. We had listening sessions with people with lived experience. We brought in people from community-based organizations, leaders in the community. We opened it up for public comment. And amongst the OIT members, we had several planning sessions throughout the about 6-month process. So our local overdose fatality review team, again, it's comprised of a diverse group of stakeholders, medical providers, city agencies, and again, CBO, community-based organizations. We conduct case reviews of overdose deaths with the goal to better understand where there could have been, where there's gaps and where we could potentially make a difference and how future overdose can be prevented. At the end of every meeting, we make recommendations. The committee makes recommendations to address systematic gaps. Sometimes there's many recommendations in an OFR meeting, and sometimes there's few. And that's really based on the information that's available of the decedents that we do review. During those meetings, we also have themes we typically come up with. So if we're seeing trends, if we're seeing any type of information that we want to take a deeper dive into, we do look for cases that mirror that trend. Soon to come, we are going to be having friends and family interviewing. This is going to be modeled after the fetal infant mortality review. We will be the first jurisdiction to have friends and family interviewing. There's a few others that are trying to do this. And the intention is really to bring a better understanding of circumstances of death and where there could have been gaps, and also to provide resources to those impacted by the death. So at the health department, we have a plethora of city of program partners. So some of those are city agencies, Baltimore City Fire Department, Department of Planning, Baltimore City Public School System, Mayor's Office of Homeless Services. Those agencies, it's not limited to just those, but those are some of the agencies that we have been most recently working with to come up with initiatives to address stigma, to address education needs, to address harm reduction, distribution, and things like that. We also work very closely with the Behavioral Health Systems Baltimore, who is our local behavioral health authority. We've been working with young people in recovery and More Than a Shop. That is a collaboration that is going to be rolling out as soon as the contract is in place. That is going to be a community of first responders that's going to be bringing education and awareness in non-traditional settings, such as barbershops, and really working with young people, because that is often a population that may be missed. So we're super excited about that. We also work with the Maryland Peer Advisory Council, IBR Reach, which I'll get into in detail in a little bit, and Johns Hopkins University. Just to kind of give a brief overview of where our funding comes from. So we do have a few different grants right now. We have state and federal. We do get funding from the OOCC, the Opioid Operational Command Center. That is in the final year of the 5-year funding. And then we also have the Overdose Data to Action. That ends at the end of 2023. And then we also have our SAMHSA grant. Again, we are in the 4th and final year of that funding right now. And that is a project that we collaborate with BHSB and the fire department on. So just to talk a little bit about some of our initiatives and some of our programming, we have at the health department, we are an overdose response program. We are certified as an ORP with the state, and we have continued services throughout COVID-19. And what our ORP essentially is tasked with doing is making sure that our community is educated in naloxone administration, how to recognize an overdose, just understanding addiction itself, providing those type of educational sessions. And we also distribute quite a bit and a lot of Narcan, as you can see here, from July 1st, 2021 until September 30th. We have distributed 884 kits of naloxone and trained 884 residents on how to use naloxone. We've had 11 educational events that have been held either virtually or in person. We have the Leave Behind program that is in collaboration again with the Baltimore City Fire Department. From January 2020 to October 2021, we have the Baltimore City Fire Department has distributed 905 kits of naloxone to residents and trained them in how to use it. OIT supports the expansion of the distribution criteria, and that's currently pending with the fire department. Another program that we have through some of our funding is the hub and spoke model. As I mentioned, IBR Reach, which is a opioid treatment provider that is on Maryland Avenue. They serve as our hub in the hub and spokes network of buprenorphine treatment. The model offers same day or next day intake for residents with opioid use disorder. They offer buprenorphine induction and stabilization. Referrals are made into spokes for long-term community-based treatment. So the spokes are those non-traditional settings where people could get more wraparound services. So a spoke could be a primary care provider, it could be an OBGYN, but they are trained in how to treat opioid use disorder in that office. So transfers between the hub and the spokes are made bidirectionally, and patients may transfer back and forth as needed, because again, the hub offers a lot more intensive treatment, whereas once they're stabilized, they can transfer back to the spoke. So they offer support also to medical providers. So they offer medical consultation to prescribing providers in the community. Currently, there are 8 major spoke partners that IBR Reach works with. We have our Levels of Care initiative. So Levels of Care it's taking all 11 hospitals. All 11 hospital systems came to the table back when this initiative started, and they have been ranked as a 3, 2, or 1 based on what they offer. So a level 1 is the most comprehensive offerings by that hospital. And the goal is really to provide evidence-based care to patients with opiate use disorder from all the way from the emergency rooms to the inpatient setting and outpatient setting. We are currently in a review process, so we will be reevaluating and putting out the new rankings. Right now, as you can see, all of these hospital systems have been ranked again between 3, 2, and 1. We do anticipate there being more 1-level hospitals, and you can visit our website if you want to know more in depth of what a level 1 entails. But again, it really encompasses their entire hospital system from emergency room all the way to their outpatient settings. And just to know, Grace Medical will be excluded as of 2021, so you will not see that as they have downgraded as a medical provider. Another program that I wanted to talk about today is Healthcare on the Spot. So that is one of our collaborations with Johns Hopkins University. This is a mobile treatment provider that provides low threshold treatment in the community. They meet the patient right where they're at on the street. They offer confidential services. They offer STI, HIV testing and treatment, PrEP and for HIV prevention, hepatitis C testing and treatment, buprenorphine, wound care, and case management. So during COVID, SUD treatment and case management provided through telemedicine visits has really shown to be one of the most impactful things and most positive things that have come from COVID, I think. Currently, they manage 130 patients with OUD, And the retention rate has just been phenomenal. The retention rate since March of 2020 has shown to be 80%. And just to put that into perspective, the retention rate before that was approximately 50% at month 1 and 25% at month 3 when doing inpatient visits. So offering out that telehealth option has really proven to be one of the most impactful ways to provide mobile treatment. And so next, I wanted to talk a little bit about what an OPS, overdose prevention site is. I know that was mentioned as something that you all wanted to learn a little bit more about. So it is defined as a harm reduction intervention that helps mitigate the harms of drug use through site monitoring and rapid intervention by trained staff. The model provides a harm reduction program aimed at reducing harm to clients' health while connecting them to care and recovery. And I think that that's something that really needs to be highlighted here is the connection to care and recovery, because a safe an overdose prevention site is so much more than just that. It really does create a community for individuals who otherwise may have felt excluded. So the harm reduction program is part of the continuum of care for people with substance use challenges who often have complex medical needs, including severe mental illness, HIV and AIDS, and hepatitis C. So again, the services provided at an OPS, of course, safe consumption and observation rooms monitored by medical professionals. But then there's also education and access to medicated assisted treatment, recovery counseling, basic medical services, referrals, support services such as housing, public benefits, and legal services. So there are approximately 120 OPS sites in 11 countries and 2 in a planning phase. So some of those countries are Switzerland, Germany, Netherlands, Sydney, Australia, Canada, Spain, Denmark, Norway, France, Australia, Luxembourg, Ireland, and Scotland. So OPS status in the United States, currently there are no active sites to date. Philadelphia and Rhode Island are probably the closest to opening, Rhode Island being very close. Several other states support the idea, but again, are working through the barriers. Baltimore City advocacy groups work tirelessly. You all will hear from one today, BHRC. They work tirelessly to gain support, and the health department supports these efforts to bring the concept to Maryland. And lastly, opioid treatment providers. So an OTP, if you hear that term, it simply means a program or practitioner engaged in opiate treatment for an individual with an opiate agonist medication. There are currently 32 OTPs in Baltimore City. And the health department supports treatment providers. I'm sorry, it's working. We currently support treatment providers by addressing training needs, ensuring access to Narcan, and coordinating through stakeholder work groups. We do involve them quite frequently in many of our work groups. Behavioral Health Systems Baltimore really provides the general oversight and licensing for these sites. So that is my presentation for today. I hope you all can take something away from that. And if you have any questions, please let me know. And I will pass it back over to Kelly.
Thank you very much, Brittany. And I believe we have Adrian Bridenstine from Behavioral Health System Baltimore to talk a little bit more briefly. I think we're running up on time, but thank you, Adrian.
Good morning. I'm Adrian Bridenstine, Vice President of Policy and Communications at Behavioral Health System Baltimore. I'm going to share my screen, but we'll quickly go over just our role in supporting and coordinating with the response to Baltimore City's overdose crisis. So if you'll give me a second. share my screen. Can you all see my screen?
No, you may not have the share. I don't have access to share on mine either.
Ah, okay. Well, I am happy to just talk. um, again, thank you for the opportunity to talk with you all this morning about Behavioral Health System Baltimore's role in coordinating the city's response to the overdose crisis. For those who know us and those who don't know us, I'll just do a quick refresher. As Brittany said, we are the local behavioral health authority for Baltimore City. We are a nonprofit, and in our role as the local behavioral health authority, we are responsible for overseeing the full continuum of behavioral health services within that public behavioral health system. So that is anything from prevention to early intervention to treatment and recovery support services. We have a couple of core functions. One of them is managing public funds and being local system partners in that system manager role that I just explained. But in terms of state system context, it's important to point out that Behavioral Health System Baltimore operates as the local arm of the state health department. So we have an MOU with the state health department that outlines our role in being able, or our role in overseeing that public behavioral health system. And again, that's that network of providers and programs that provides that full continuum of services. Last year, just for context for the city, Baltimore City does represent the largest share of the public behavioral health system for the state. Roughly around 35% of the public behavioral health system is within Baltimore City. That equates to about 78,000 people that get behavioral health services in Baltimore City annually. Roughly 26,000 people are getting substance use services, and we know a bulk of those services are people seeking services for opioid treatment. One of our roles, as I mentioned, is managing public funds. In the course of, I very much apologize. My son is homesick with me today. You probably hear him. I'm sorry. I apologize. Still the life of COVID we live. As I mentioned, so one of our roles is overseeing public funds. Last year, BHSB received and granted out roughly $45 million to 109 organizations in Baltimore City. For every dollar that comes into BHSB, roughly about 80% of that goes out to community services. These community services that we fund are services that are not reimbursable through Maryland's Medicaid program. So those are services like recovery housing, some of the buprenorphine initiatives, which are opioid-specific programs I'll talk about in a bit, our overdose prevention services. Those are all the types of services that we grant fund for the city of Baltimore, again, because they're not reimbursable by insurance. But in terms of coordinating response to the overdose epidemic, there's 4 key areas that BHSB has been really active in with our partners at the health department, but also stakeholders across the city. First, being collaboration with our stakeholder partners, and Brittany covered some of the groups that we participate in to help coordinate response. The other is with overdose prevention and education. The third is with broadening access to opioid treatment and recovery supports in the community. And then finally is our advocacy work for harm reduction service, broader use of harm reduction strategies and overdose prevention sites. So in terms of our collaborative strategies, we do sit on a number of the groups that Brittany had mentioned earlier. Those include the Overdose Fatality Review Committee, the OIT. We do also, in our role at BHSB, coordinate quarterly opioid treatment program forums, and this is a forum where we bring together the opioid treatment programs across the city to troubleshoot and address any system changes or challenges they might be experiencing. And then finally, we do have a regular internal overdose prevention and response meeting with the Baltimore City Health Department. I think you all can see my screen now. I think I might have figured that out in the middle of talking. The overdose prevention work that we do may be familiar to some of you. Be More Power is a peer-led overdose prevention team that works throughout Baltimore City. It's a network of people with lived experience with drug use who actively go out into our communities, specifically communities where we know there is active drug use and where we know there are increases in overdoses happening. And they go out and they conduct outreach and educate people on how they can prevent overdoses and administer overdose prevention kits, which include naloxone. Last year, we distributed over 10,000 doses of, 23,000 doses of naloxone throughout the community. One of the other things our Be More Power team also does is they do a lot of educating of the community about fentanyl. We have all heard about fentanyl. It is still very pervasive on the streets here in Baltimore City and is a major contributor to the overdose fatalities in our community. So in recognizing this, our Be More Power group realized that there's a lot more we can be doing to talk to our community members, to talk to active drug users about how they can safely use the drugs that they're buying and to prevent an overdose. And one of them is going slow, inject slowly, if that's how you choose. So that is, you may have seen what you've seen on the screen, a couple of campaign slogans throughout the city, but it's the Go Slow campaign. Again, this is educating people about, you should assume that fentanyl isn't anything you're buying, and that when you do use, you should use very slowly, never use alone, and make sure you're always carrying your naloxone with you. One just kind of specific community example I'd like to tell you about is a recent connection that we made in the Darley Park neighborhood of Baltimore City, which I know many of you know is in Northeast Baltimore. One of the things that, so we had continually, BHSB had been continuing to hear from residents in that community who were concerned about specific homes in that neighborhood where they knew people were experiencing overdoses on a pretty regular basis. Our community engagement coordinator, who I knew many of you know, Gwen Brown, has been very active in that community and got to know what the neighbors knew, which is where people were actively using out in the public, but then also where they were buying their drugs. And what we learned is that people were going to the Citgo on Hartford and 25th Avenue, and that was known as the jump off, and that's where a lot of overdoses were happening. So Gwen, using her smarts, coordinated with our Be More Power group, and they have now been showing up at the Citgo to provide overdose prevention and naloxone kits. The first day that they showed up, an overdose actually happened at the Citgo earlier that day. And the staff there did not know how to respond. So Be More Power trained them, provided them with naloxone, and they're now equipped to better respond to their community needs. So I just wanted to share that example so to kind of explain a little bit what and put a face on the work that Be More Power does, because I think it's so important to our community. They are at the grassroots level, and they are actively connecting with people who are using drugs in our community and helping to save lives on a daily basis. The third area where we're coordinating overdose response is with that broader treatment system. There are 35 opioid treatment programs in Baltimore City. We've recently had some more expansion. This network of opioid treatment programs is where a majority of people with an opioid use disorder are actually getting their treatment. It's through this network of 35 treatment providers in Baltimore City. Our role is to oversee them. These providers are licensed at the state level, but at the local level, BHSB does a lot of work to support this network of providers. Like I mentioned, we do our quarterly convenings. We provide trainings to them. We investigate complaints at not just opioid treatment programs, but at all programs throughout the Baltimore City area. We would provide technical assistance. But again, this network of 35 programs is where majority of people get their treatment services in our city. And then we have a couple of other targeted programs that are, again, focused on access to opioid treatment. The Hub and Spokes project, which is a similar project to what Brittany had mentioned earlier. Here we partner with the University of Maryland, their opioid treatment program. They are the hub in this project, and they have 5 spoke providers out in the community. And again, those are psychiatrists, primary care providers, but the spoke providers, or the hub, as Brittany mentioned, is where people get stabilized with their medication. Once they're stabilized, they are referred to one of the spoke providers who help that individual with their maintenance and other recovery supports they need out in the community. 87 individuals were served in this project last year, and this is a new project for us. Another one is methadone home delivery, where we served 218 people last year. Most people get their methadone by going to their opioid treatment program, but there are certain instances where people become homebound, or they're sent to a nursing home for more acute care. And one of the things that we do is make sure that when people are put in a homebound situation or sent to a nursing home, is that they still have access to their methadone, which is something most people need to take on a daily basis. So that's what we do through the methadone home delivery project. It's basically having the methadone taken to that person where they are homebound or where they are staying permanently for an extended period of time. The fourth is the buprenorphine initiative. So this is really focused on expanding access to buprenorphine specifically to people who are uninsured. So these are two very kind of small programs within this initiative. First is the office-based opioid treatment program. This is working with primary care providers to initiate buprenorphine within their offices. The second is what we call our PCARES reentry van. This is specifically serving people who are discharged from jails and prisons who are uninsured at that time. Both kind of small programs, but it's important to make sure that we are engaging people who are uninsured to get them engaged in treatment, but then get them enrolled in the Medicaid program. And then the last one is our patient medical engagement project. This is again a small project, but a really important one. And it is specifically for serving people who have been hospitalized as a result of their opioid use disorder. We know many people who inject drugs often have other kinds of wounds and acute acute somatic care that ends up putting them in the hospital. So what we do through this program is coordinate with the hospital so that upon discharge, the people are connected to the right care in the community. Another really important part of our network of providers, but then also a really important part in supporting people with opioid use disorder with recovery are our network of wellness and recovery centers. We have 6 centers that provide care to consumers throughout the Baltimore City. All 6 of these centers are peer-driven and peer-run, which means they're run by people with lived experience. Over the course of the last year, you can see in the screen that over 78,000 people came into these centers over 78,000 times. The centers provide a range of types of services to people, whether it's one-on-one peer support sessions, group sessions such as Alcoholics Anonymous. They provide people with GED support, job search support. They also play an incredible role in helping to connect people to care in the community. Our wellness and recovery centers are sort of operate in a way that there are no wrong door. They will see anybody who walks through their door. So very often they are seeing people who are still actively using, but it's a safe place for people to engage, and it's a safe place for people to get that one-on-one support. And when they're open to it, and if they would like to, the centers also help to connect people to treatment in the. And then the last thing I'll talk about is just our advocacy. We do a lot of advocacy around broadening access to harm reduction strategies. Our philosophy is that, and the philosophy of harm reduction is that we will always live in a community where there is drug use, and we should acknowledge that, and acknowledge that the ending the war on drugs has not worked. It has resulted in more people in our community ending up being criminalized as a result and ending up being in jail, particularly people of color. So one of our advocacy efforts has been trying to dismantle the war on drugs. And we are really happy that Secretary Becerra was in Baltimore City a couple of weeks ago and acknowledged the harm that the war on drugs not only did to our community, but across the country. One of our other efforts is around decriminalization of drug paraphernalia. We think that goes hand in hand with ending the war on drugs. And then the third effort is broadening the use of fentanyl test strips, which is essentially a strip that you use to test the drugs that you have bought to see if fentanyl is in it. Again, it's another strategy, harm reduction strategy that can help people be more aware of the drugs that they are using, and they can more safely use them. And then the last thing I'll just say is we are very supportive of overdose prevention sites. You heard Brittany explain what they are, but BHSB is an active member of the Bridges Coalition, and I know you're going to hear more from them in a little bit today, so I'm not going to say much more other than they have launched an amazing campaign called Yes in My Block that they'll talk about in a little bit, which is to educate our local community about how overdose prevention sites can add value, safety, and better health for our community in Baltimore City. So I'll save that and let them talk about it in a little bit. And then I'd just like to end with, as always, I'd like to share with the committee what community resources are out there. I think you all know and have heard about the Here to Help hotline. This is Baltimore City's 24/7 behavioral health hotline. It's available all the time for free confidential advice and can make referrals to services, can also deploy mobile crisis teams if there is a really serious situation. Our Crisis Stabilization Center, and then two family support services, NAMI Metro and the Maryland Coalition of Families Peer Support Services. So I know this resources are always shared with you, but just wanted to point them out. They're great resources for you to be sharing with your constituents if you would like to. And that's all for me. Thank you, and I'm happy to take any questions.
Perfect. Brittany, Kelly, Adrian, thank you so much for your presentation. We're going to move on to our next agency. We have a lot of agencies to get through, and I want to make sure that we are able to ask questions. So for our upcoming agencies, I'm asking that you highlight particular items within your report that you want to make sure that we know. And try to keep this to a maximum of 3 minutes. I also just wanted to ensure that our health department, who does a significant amount of the work, had enough time to present their information. So up next is going to be the police department.
Good morning, Chairwoman McCray, members, excuse me, members of the committee. For the record, my name is Michelle Wurtzberger. I am the Director of Government Affairs for the Baltimore Police Department. Madam Chairwoman, I just want to say personally, thank you for your commitment on this issue. This is an issue that is very, very personal for a lot of us. For me, my youngest brother has had to be revived 6 times with the use of Narcan. And most of those instances, he had to receive multiple doses to be revived. It's heartbreaking, it's traumatic, and it's just god awful, not only for the user, but for the family. So I just want to say thank you. For our presentation, we have a number of folks with us. We will be brief in lieu of your statement earlier. We have Lieutenant Colonel Jack Herzog, who is going to lead our presentation, but we also have Lieutenant Colonel Monique Brown and Major Derek Loeffler present in case you have any additional questions. And of course, you have me and Shannon Conway. And with that, I'm going to turn it over to Lieutenant Colonel Herzog.
Thank you, Michelle. And good morning, Chairwoman McCray and committee members. Again, I am Lieutenant Colonel Jack Herzog. I'm the Deputy Chief of Detectives for the BPD. I also want to echo what Michelle said. I thank you for the opportunity to testify before you today on such an important topic. And so I want to say that BPD has come a long way in terms of our overdose response strategy. And I think to understand where we are now, you have to understand where we used to be. And so prior to 2016, we did not have any policies geared towards addressing overdoses, responding to overdose events. We didn't have any specific services to offer to victims when we were showing up on these scenes. And we didn't even collect data. We didn't have naloxone. So prior to 2016, we didn't write reports. We really would just call for EMS, and once they showed up, we would clear the scene. And that was pretty much our typical response. And so when we noticed the huge spikes that were coming as a result of fentanyl, we collectively worked together internally and externally with our partners to curtail our response towards overdoses. And so beginning really in 2016, I would say we began building out many strategies. And some of those strategies are that we developed policy, we provided training, we issued naloxone, we now direct victims towards treatment, non-fatal victims that is. collect data. We target suppliers of opioids and heroin. We deploy to spikes, and we have a heroin coordinator who specifically is geared towards tracking overdoses in heroin and fentanyl and other opioids. Going back to the directing towards treatment, we created that. It's called a Form 23 internally. And what that is it's given to all non-fatal overdose victims or their family members or loved ones or others on the scene. And that provides them with services that are available to help with them. This includes information such as healthcare on the spot, which we already heard about, crisis hotlines, clinics, syringe programs, naloxone programs, and the like. We now factor the number of overdoses that occur in a particular area into our case selection process for where and how we work our investigations. And so I also just want to point out really briefly, and I'm almost done here, ma'am. Just this year, BPD has saved 89 lives using naloxone and has saved 149 lives in 2020. And so this was just simply through naloxone. A naloxone pilot began back in late 2015. In 2016, we ramped up issuing that. And now today, every member of the agency is issued naloxone, is trained in the use of naloxone. And so I've seen a huge culture change in terms of how officers are responding to these scenes and getting right to work and trying to save lives. At the end of the day, it's about saving lives. And so, again, there's a lot of room for improvement, but we look forward to really working with everyone for a more coordinated, unified, and effective response to overdoses. And again, ma'am, I thank you for your time and the opportunity to testify today. And I'll be available to answer any questions at the end. Thank you.
Thank you, Lieutenant Colonel. Thank you, Michelle. Thank you for all. I see a lot of faces from the BPD who are currently joining us. So thank you all for being here and available to take our questions. We are going to move on to our fire department at this time.
Madam Chair McCray and council members, good morning and thank you for the time to speak today. My name is James Matz. I'm the Deputy Chief of EMS from the fire department. Can somebody elevate me so I can share just a couple of slides? I'm not going to kill anybody by PowerPoint, I promise.
And sir, just want to let you know I know you just have a few slides, just try to keep it under 3 minutes. Thank you.
Or I can talk through them. I can talk through them if you want to.
That'll work as well.
Okay. So basically what I wanted to briefly talk about is the COVID-19 pandemic was a public health crisis globally. It became a primary focus of everyone. It had a huge impact on our frontline workers, public health workers, first responders. I think some of that got lost, our response to the opioid crisis and our response to the pandemic. I know yourself earlier were discussing some of the continued trends of increases in opioid-related intoxication deaths. Some of this is due to the pandemic, but the fire department has taken this trend seriously. We've been longtime partners with the health department and will continue to collaborate to change this trend. Some of the programs that we've combined and worked on together, they briefly talked on earlier, the SAMHSA First Responder Comprehensive Addiction and Recovery Act grant. Basically, under this grant, the fire department developed a near real-time notification system of outreach workers to respond to individuals with substance use disorders or overdose contact, EMS seeking treatment but not wishing to be transported to the hospital. It was developed in partnership, as they had said earlier, with People Encouraging People, EHSP, as well as with the health department. We're also active in innovations and recovery through infrastructure support. It's called the IRIS Bill. That's a research grant awarded to People Encouraging People to develop and test tools for evaluating various programs and interventions on their effectiveness. The fire department helps identify study participants, and we facilitate efforts with the various stakeholders, including People Encouraging People. I think they talked about it earlier. I can't give enough credit to the Leave Behind Narcan program. We are an example for the rest of the state, at least from the EMS perspective, with the Leave Behind program. It's a grant-funded program to purchase naloxone kits that are left with the public during the fire department response to overdoses. To date, since the inception of the program, we've left over 2,000 kits behind, or 4,000 doses of Narcan. Finally, the Stabilization Center at Turk House. That was that grant-funded alternative transport location for patients suffering from substance use disorders. The center offers medical screening, connections to social services, and medication-assisted treatment. The fire department played a pivotal role in the development of that center, and EMS continues to transport individuals to the center. We're very active, as I had said earlier, with the opioid intervention team, as well as overdose fatality review, and I'm not going to beat that to death because I know we just talked about it. We were also very active in some of the older programs, for instance, the anti-stigma training for new and existing EMS, EMTs and paramedics. We also worked with civilian naloxone training program in 2017. And then lastly, this ladder study and the refusal to transport study of 2014. The fire department will continue to partner and collaborate with the health department to provide effective and compassionate care to the citizens with substance use disorders. And we will strive to reduce the incidence of overdoses with residents and guests of Baltimore. Thank you, Madam Chair.
Thank you, Chief EMS. You guys are doing some great work. I know how important your agency, as well as all of our agencies, are to this fight, but we just want to recognize you at this time for the work that you guys are doing. The Mayor's Office of Performance and Innovation.
Thank you, Madam Chair, members of the committee. I'm Dan Heima, the Director of the Mayor's Office of Performance and Innovation. We've had a chance to review the bill and submitted a response. Just to say that as you know, our office, which includes City Stat, operates a number of stat performance management meetings in collaboration with Mayor Scott and City Administrator Shorter. Building on some of the key issues that the mayor asks our office to focus on. Currently, OPI is not operating a focus stat on the issues referred to in this bill, and so we defer to the response from the Baltimore City Health Department and the presentation that was just made. Thank you.
Thank you, Director, and thanks for your report. We appreciate the information. We're going to move on to the Mayor's Office of Neighborhood Safety and Engagement.
Good morning. My name is Nick Wilson. I'm the Associate Director of Policy Planning and Coordination for Moliti. With Baltimore City on track for over 1,000 intoxication deaths this year, it's clear that we must address the silent pandemic in a coordinated way. Moliti is committed to being part of the solution and appreciates the opportunity to highlight a few parts of our report. As we learned from the Health Department's informative presentation, Baltimore City agencies and community partners are already doing the difficult but necessary work to respond to this crisis, including expanding provider coverage, investing in outreach to connect individuals to treatment, offering low-threshold treatment integrated care, and expanding harm reduction education efforts. But to put it simply, these evidence-based efforts are happening in Baltimore, but we need a lot more of it. It's still too difficult for many individuals to access treatment. We need to increase the capacity of providers, invest in support services, especially peer outreach that connects people to treatment. And then we also need to invest more in harm reduction groups that are providing wraparound services to support these individuals that are in treatment. I do want to highlight some great programs that we do have that we need to, I would suggest we expand. These are the low threshold treatment and support services that remove burdens and meet people where they really are. About 15 years ago, the Behavioral Health Leadership Institute launched a mobile medical support and treatment van, recognizing that transportation is a common factor for individuals seeking treatment, common barrier, and where people kind of fall in the cracks, even if we have these hub and spoke models. So by having these mobile clinics park outside central booking and intake center or outside of community organizations, they're really able to provide medication and treatment to where people are. You heard today that based on the success of this nonprofit effort, the health department launched the Healthcare on the Spot mobile unit. In addition to the treatment options and integrated care that you heard about today, I just want to highlight that these mobile clinics allow service providers to build rapport and trust, increasing the likelihood that individuals will receive routine care, which is the goal. So even if an individual does not accept services at initial contact, or maybe they relapse, they know they can always come back without judgment. While the health department and medical professionals can prescribe medication, they can't prescribe housing and financial support. And so we need to expand emergency shelters as part of the city's response to the overdose crisis. People using out in the open or in abandoned homes really elevates the risk. They're more likely to inject quickly. But we really want them to start small, as we heard today, to mitigate the risk of fentanyl. So the research shows that stable housing really reduces the risk of overdose and makes recovery more likely. Harm reduction strategies like increasing access to fentanyl testing strips, syringe exchanges, and increasingly hotlines or phone apps that reduce the risky activity of using a loan. These are all really helpful tools that are currently in use, but housing is a vital and expensive issue. I just want to, one more thing I'd like to mention is that Moliti is committed to being part of the solution, and we are starting by currently soliciting grant applications from local nonprofits that want to increase access to community education and outreach and treatment. So you can go to our website and submit a letter of intent, and we will work with you in the community to get some money immediately out into where it's most needed. Thank you for this opportunity.
Thank you for being here, Mr. Wilson. We are moving to our Mayor's Office of Emergency Management.
Good morning, Madam Chair and honorable members of the Council. I'm Jen Moliti, Deputy Director of the Office of Emergency Management. I would like to highlight the Office of Emergency Management's participation in the Opioid Intervention Team, the development of the Opioid Strategic Plan mentioned in the Health Department's presentation, and our participation in the OOCC at the state level. We stand by our report and stand ready to support our partners in the cities and states' response to the opioid epidemic. Thank you.
Thank you, Deputy Director. City Solicitor's Office.
Hello, Madam Chair. This is Hilary Rooley from the City Solicitor's Office. We approve the resolution for form and legal sufficiency.
Thank you, and thank you for being here. At this time, I'm going to open the floor to committee members for questions. Committee members, please signal to me or use the raise hands function. If you have a question for an agency, I'm going to go ahead and start with my question. In 2016, under former Mayor Rawlins Blake, our health department convened a citywide fentanyl task force. One of the recommendations was to distribute rapid testing kits to test for fentanyl. Is the city currently providing fentanyl test strips to help drug users protect themselves? And if not, has the city investigated whether doing so would be effective in preventing overdoses? That's going to be for our health department.
Thank you very much for that question, Madam Chairwoman. I will say, yes, we do have fentanyl test strips. We do distribute fentanyl test strips through our syringe exchange program, through our ORP, and through healthcare on the spot. The OOCC actually does provide those test strips at no cost to the city and to all other jurisdictions of Maryland.
I also want to acknowledge that we've been joined by Councilwoman Porter. Ms. Spencer, I do apologize, but it looks like there was a break in the connection, so I didn't hear your last statement. Can you go ahead and repeat that, please?
Sure. I was just saying that the OOCC at the state health department, they do provide the fentanyl test strips at no cost to all jurisdictions in Maryland that are registered as ORP. So that is where we get our fentanyl test strips.
How many are we distributing, and can you speak to how we're distributing those fentanyl test strips? And I'm bringing that up because we know that within Baltimore City, there is a very high percentage of fentanyl being included within the drugs that are being distributed. So how are we distributing that? And how many are we distributing?
Sorry. Yes, that is a great question. So we do distribute those through our syringe exchange program and healthcare on the spot and our ORP. We do not track, we do track how many Narcan kits we distribute, but we do not necessarily track how many fentanyl test strips we give out. The clients are very well aware that those are available to them. They are offered to every client that they do see. We have anecdotally found, however, that the clients, at least from syringe exchange program, the fentanyl is so prevalent in most all drugs that some of the clients or most of the clients feel that it's pointless to test, but we do provide them and provide them with the education as to why that is important to test and to just know and reinforce that the fentanyl is there and that if they are going to use that drug supply, they need to use it not alone and slow.
So I'm going to give you another follow-up. We're getting these test strips from the state of Maryland. How many are they giving us yearly to distribute?
I do not have that number readily available. If I could circle back with you and give you that number, I will.
That would definitely be fine. if you could just furnish that to the committee, we would appreciate it. And Natasha, that's going to be our first request. And thank you, Brittany. I want to move on because one
Madam
thing I
Chair,
think, yes.
I don't mean to interject, but for that specific request, I think it would be really helpful to get it in terms of our percentage of the statewide distribution. A couple of years ago, we were experiencing, I think, 30% of the overdoses in the state, but only receiving 15% of the naloxone kits. So it'd be really helpful for us to understand where we stand in terms of statewide distribution.
Thank you, Councilman Dorsey, and also thank you for interjecting. So Brittany, if you heard Councilman Dorsey's request, if you could just furnish that to the committee. I appreciate you both. I'm going to move on. It seems like I skipped over a department, so I'm going to just hit back to agency reports. I don't know if anyone's here, and actually I do see someone here from the Department of Finance. Mark, can you provide the report for the Department of Finance, or if you guys want to stand by that at this time?
Certainly, thank you. Mara James, Legislative Engagement Lead for the Department of Finance. We stand by our report. We defer to the lead agencies on this matter, but are here to answer any questions as needed. Thank you.
Okay, perfect, Mara, and I apologize about that. So thanks for your patience. I see that you're here. I'm going to go right into a question for the Department of Finance. How much is the city currently spending on its response to the opioid epidemic?
So right now, for the health department specifically, they have a budget in fiscal 2022 of $4.7 million for substance use disorder and mental health service. Across the other agencies, we would have to pull more detailed data and work with each agency to pull that out, work on that for you.
Can you furnish it to the committee, just as you said, agency by agency? The reason I'm bringing that up is that we are consistently talking about population decline. And when we're talking about population decline, a lot of times we're not talking about the people that we're losing to the opioid epidemic. When we're losing people, we're losing folks who are also able to make sure that their families stay in Baltimore as well. Some people may not have an opportunity to grow their family. So that's why that information is very important to me. We're losing a lot of folks to the opioid epidemic, obviously murders, and that impacts our population loss as well. And I want to make sure that that's highlighted at this time. Committee members, we have 2 questions. At this time, if you have any questions, let me check the raise hand function, or you can just signal to me as well. And I see Councilman Dorsey has his hand up. Councilman Dorsey, at this time, the floor is yours.
Thank you, Madam Chair. I guess I have a couple, we heard a lot of stuff. I have a couple quick comments to make. One, specifically, because you did just bring up population loss. I mean, I think that that's incredibly important. If we've lost 10,000 people, residents in the city, we've lost 10,000 residents to opioid overdose and drug overdose in the last 10 years. So that's, I mean, that's a huge factor. But and we also heard from Nick and Monsi talk about the importance of housing in preventing overdose death. It's worth mentioning that we use drug use as a screening mechanism, preventing housing opportunity for people. This is an inherent problem in our programs that in many of the government-funded programs to assist people in achieving housing stability, and is working clearly at odds with the ability to prevent overdose. So I think that that's really worth mentioning as something that needs to be addressed in terms of marrying housing opportunity and overdose prevention. I guess one of the things that comes up for me, and I hope we're going to hear from Baltimore Harm Reduction Coalition. I did see that a slide presentation was distributed to committee. One of the things that I've talked with some of the folks there about is the lines like out the door at opioid treatment centers. When I go to the dentist, I get to sit in a waiting room. When I go to my physician, I get to sit in a waiting room. I just don't understand how we can say that we're providing healthcare with dignity to people if we're making them stand on the street in order to wait in line to get their healthcare. And I wonder if there's anybody who's presented so far who can speak to the ability to better address this need for healthcare with dignity.
We have a lot of agencies here. Is that something that the health department wants to tackle at this time?
Or behavioral health systems?
And Councilman Dorsey, I did want to highlight behavioral health systems. She had a prior engagement, so Adrian should have left out at about 11 o'clock. So Brittany, are you able to address that?
I will say that, I completely hear you, Councilman Dorsey, in regards to patients, having to stand outside and things like that. So I think that I would defer to Adrian and BHSB in working with OTPs, and the health department will support in any way that we can to improve that function.
Yeah, I mean, I'd love to see that as part of our very strong and clear advocacy for change at the state level, if that's what needs to happen. It's just an unacceptable way for me. To me, it's an unacceptable way to provide healthcare to people, and is a clear indication of how, the prevalence of overdose is in so many ways cloaked in stigma. I mean, I already talked about preventing housing for people because they're drug users, but the continuance of the war on drugs and the city's own expenditures for drug enforcement are a part of that stigma proliferation. This is another one of those points. So it really needs to be a part of our advocacy effort to demand that people have more dignity and access to treatment. The other question I have is specifically for the health department. How many people do we have serving as health department employees? I'm not talking about our partners, health department employees who have lived experience with firsthand. I'm not even talking about family members and friends. I'm talking about firsthand experience with drug use or overdose themselves. Drug use presently, past, whatever. As a person who has been in recovery myself for almost 20 years, I cannot express deeply enough the importance and centrality of lived experience in being able to convey the availability and effectiveness of recovery and the opportunity that does exist for people.
Yeah, thank you, Councilman Dorsey, for that question. So in terms of, people with lived experience, I couldn't agree more that I think that, having people with lived experience, it's critical, right, to work in this space. But I also want to, point out that we don't necessarily ask. That's not a question that we would, come out and ask if an individual had a history or active, drug use history. But I will say that a lot of our peer recovery specialists have firsthand or lived experience. A lot of our syringe exchange staff have firsthand or lived experience in working in this space. But again, that's that very kind of specific question is not something that we necessarily ask. I could get you a number of the number of BCHC employees that are under that category of peer recovery specialists. I just would have to reach out to that department to find out exactly how many there are.
I guess I appreciate that. I mean, just to put a fine point on it, and then I'll allow the chair to move on, is I know it's one thing to not be asking those kind of questions on job applications. It's another thing to say, I'm specifically seeking somebody to fill a position that has this experience, and you need not apply if you do not have this experience. And to be seeking somebody with that experience at the highest level of leadership on this subject for the city, because I think and I know that it is that critical to successful availability of treatment. Thank you, Madam Chair. I do have some other things I might say, but later.
We appreciate you, Councilman Dorsey. I don't see any other hands up. So committee members, okay, I got one signal, and Councilman Conway.
Thank you, Madam Chair. I had a question that actually is tied to a hearing that the Public Safety and Government Operations committee held last week. And so we had a really in-depth conversation with the fire department talking about EMS and our emergency response to the effect of overdoses in drug treatment. The long and short of it is there were 3 major issues that they saw, 2 of which were homelessness and overdoses that were a huge pull on emergency resources. I was curious, and maybe I would even, of course, imagine the fire department can speak to this, but also even the police department as they get called for these as well, and perhaps the health department as well. What resources do we put toward making sure that when someone does have an overdose event, we're wrapping that person in services so that they hopefully don't have a second one? How's that system work? And how are we coordinating with at least those 3 agencies, potentially more, given we know that this is a huge problem from a number of perspectives, not just from the health perspective, but also from our fire department's perspective, our police department's perspective, and more. So that's a question that can, I guess, go out to the 3 agencies, BPD, health, and fire.
I guess I'll be the first one to go. So from the health department's perspective, I can speak to the program that Chief Matz had spoke a little bit about, which is the project, the first responders, the overdose prevention, or the prevention program through the SAMHSA grant that we have. So what happens is an individual suffers a non-fatal overdose. If they decline transport to both the stabilization center and the hospital, they are provided the leave behind kit of naloxone, and they also are offered outreach through people encouraging people. So if there is the case of a non-fatal overdose, the person says, yes, I do want connection to an outreach. What happens is dispatch will, or not dispatch, but the medical duty officer will then call on PEP to meet that person where they're at. So that's how that works. In terms of our connection with the police department, we are working with the heroin coordinator, which we heard a little bit about earlier. We are working with the heroin coordinator to figure out a way to have Sentinel event follow-up. So they do collect person information on non-fatal overdoses. So we're trying to come up with a project plan that we can get funded to have that Sentinel event follow-up. Because as of right now, at least from the health department's perspective, there really isn't any. And we really want to bolster and really kind of build that up in that arena. So.
Thank you. I appreciate that. I'm not happy that we don't have an answer, but I'm happy that we now see that as an opportunity, and eager to work with you guys. This will be something that we'll continue to follow up with the fire department. Of course, as we pull in folks in the future, I expect we'll have the health department in as well to discuss opportunities to make this a better system. Thank you, Madam Chair.
Thank you. Council members, do we have anyone else who has any additional questions right now?
Yes.
Okay, so we're going to go back in line, Councilman Dorsey. You're going to be after me. Was there anyone else before we start the second round? Okay, so I'm going to get right into it. This is going to be likely for OPI, also the health department. Other jurisdictions, Baltimore County, along with Annapolis, they've implemented opioid overdose data dashboards. I want to know, what is the feasibility of implementing a dashboard for Baltimore City?
Thank you, Madam Chair. So, from OPI's perspective, it's, and then probably I defer to the health department in terms of the types of data that, we have and we'll be able to, put out publicly, but we would be, welcome, the opportunity to collaborate on a project like that. Again, sort of the questions of data sources and, how, what, and metrics we would want to utilize in something like that. I would definitely want to do with, our health department colleagues in the lead. We have collaborated with the health department before on dashboards like the, like the COVID-19 dashboard. So that's something we could work on together, but definitely health department would need to drive a lot of the decisions around data and around metrics. So, would kind of defer to their expertise on that.
For the health department, is this something for Brittany or Kelly? Is this something that you guys have explored before or something that you guys have thought about?
This is something that we have most definitely been working towards. We have a subscription and have been working with a company called My Sidewalk, which is a data dashboard that people can toggle between different data sets. Our number one barrier is we are not the custodians of any of the data. We do not own the data. We cannot distribute the data. The data is owned by MIMS and by the state OCME and Vital Statistics. So our data sharing agreements are very, very restrictive. We can really share our data sets during our stakeholder convenings, but outside of that, our hands are tied. So we do have a new epidemiologist that is focused on opioid related work specifically, and he is working through the barriers, trying to work with the partners to overcome those and improve and lessen the restrictions on those MOUs and the data sharing agreements.
Okay, you know what? That's a discussion we'll have offline. Thanks a lot for answering that question and also just discussing the barriers. This question is likely centered for you as well, Brittany, and it's going to be regarding the health department's opioid intervention team. The opioid intervention team is charged with developing a citywide response plan. I understand that sometimes our websites may be a little out of whack. The only thing that I could find was a draft plan soliciting comments from, say, 2020. What is the status of that plan and when is it going to be complete?
So yes, thank you very much for that question. And because of COVID and being the agency that's responding and our PIO being very inundated with that, and now we are without a PIO, we are aware that the website is out of date. We have and I'd be happy to share the full document. The work is well underway for the strategic plan, so that has been completed. It was published in December of 2020. We received feedback from state partners. And we, as an OIT, we are going to be adding a great deal of performance metrics that we will also be publishing at the end of every year to show the community and show city agencies and show city council, show everybody the work that we're doing and the progress that we've been making.
Since we don't have access to it online, Brittany, can you just ensure, and Natasha and Brittany, can you guys just both ensure that we're getting that plan to the committee members and also making sure that each city council member has access to that plan? The draft plan has a lot of measurable goals, and we need to make sure that we're reviewing them to make sure you guys are hitting your target, all of the agencies collectively who are working on it. Councilman Dorsey, at this time, I'm going to go back to you. You're on mute, sir.
Sorry, I've had mouse problems lately. Computer mouse problems. It's not that point of winter yet. I want to talk about overdose prevention sites. This is absolutely key to our path forward. And it's great to hear the support from the city health department and the support from the behavioral health systems, our state's arm here in Baltimore City, the state health department arm here in the city. And of course, the Bridges Coalition and Harm Reduction Coalition are doing the real work there. I guess I want to know, marijuana is still illegal under the Federal Controlled Substances Act, and that is not stopping states from making marijuana legal for medical or recreational purposes. Illegality is not stopping drugs from being used, sold. It's not even slowing them down from being used or sold. And it's certainly not slowing down overdoses. And so I want to know why we are letting legality stand in the way of Baltimore City and the health department standing up overdose prevention sites. Or if that is what it is. If it's not legality, why are we not just establishing overdose prevention sites?
Brittany, what are the barriers, is what Councilman Dorsey is asking.
Yeah, so that is a great question. And I can point to the progress that's been made in both Rhode Island and Philadelphia. And I'm not sure, how many of you have followed the case in Philadelphia, but there have been, they were about to open a site and they were unable to. And really, it's the federal law that stopped them under the crack house law, is what they called it. And so essentially anybody that was involved, any staff members, any person that was participating from an employee or a client perspective would have been arrested and would have been charged federally. So there is a lot of legal hoops that people, states and in local jurisdictions are going to have to overcome. I mean, and then you also have the federal funding. A lot of health departments depend on federal funding to provide sustainability. And so if there were to be one that opened a safe consumption site, they could pull that federal funding. So those are really the major issues as to why there hasn't been one opened in the United States, let alone Baltimore City.
So to be clear about the federal funding issue, do we have other circumstances under which, like, I recognize that there isn't federal funding to create one of these. Is what you're saying that we get federal funding for other things, and if we were to do this, they would say, because you're doing this over here that's not using our money, we're going to take away your other money?
Yes, that's correct, because we would be breaking federal law.
And to be clear about the threat of arrest that you referred to, this is like the federal the DEA or local or state partners that are saying, if you do this, we're going to arrest you? I mean, or are we talking about local government. I mean, a local government can just decide we're definitely not going to enforce the crack house law.
I would have to get back to you on the specifics as to who would be doing the arresting, but I do know that that was the issue in Philadelphia, and that was the threat that was made that if they did open, and maybe during the presentation from Rajani today from BHRC from Bridges, they work very intimately in this space, and so they may be able to answer that question.
Great. Hoping and looking forward to hearing from them. Thank you. Thank you, Madam Chair. I don't have any other questions at this point.
Thank you. I'm actually going to conclude my questions. I want to make sure that we give the next portion of this program, the next portion of this hearing, the time that they need, the folks the time that they need, and also time for testimony if anyone is joining us today. So I'm going to stop right now. We're going to have a brief presentation from the Baltimore Harm Reduction Coalition. Rajani Goodlavaleti, I apologize, and Harriet Smith. And they'll be presenting a brief presentation. It'll be about 5 to 6 minutes.
Hello, all. Thank you so much for this time. And Chair McCray, I just so appreciate you giving us time to speak during this, city report out, agency report out on the overdose epidemic. So my name is Rajani Goodlavaleti, and I use she, her pronouns, and I am the Director of Mobilization with Baltimore Harm Reduction Coalition. And I'm also one of the co-founders of the Bridges Coalition for Overdose Prevention Sites, which was founded actually in March 2017 and has been around for close to 5 years now, advocating for socially just community-based overdose prevention sites in Baltimore. So we're so excited that we get to share so much, and we're over here just kind of excited to answer so many of the questions. So first things first, let me share my screen. Give me one moment. Okay. All right. I hope everyone can see that. Okay. Thanks for your patience as I navigate WebEx as a newbie. All right. So as I said, I work with Baltimore Harm Reduction Coalition. And so I thought I would just give kind of a quick overview of what BHRC is and the work of harm reduction, because we've been using that language a lot in this conversation, harm reduction. But I think it's always important to really understand, what does that mean? What does that look like? Harm reduction is a movement that started a long, long time ago in the 80s, maybe even before, mostly by Black folks, people of color, Indigenous folks, around HIV, AIDS, overdose, drug use, sex work, right? Folks who have been marginalized and criminalized in our communities. And so we have to remember that those are the groundings of this, and those are the groundings of the overdose epidemic that Baltimore has been facing for decades. So Baltimore Harm Reduction Coalition mobilizes communities for the health, dignity, and safety of people targeted by the war on drugs and anti-sex worker policies. We advocate for harm reduction as a part of a broader movement for social justice. We work in 3 different areas: policy advocacy, otherwise known as mobilization, which is an area that I oversee with my amazing, amazing crew, my team. We're all 8 staff total at BHRC. Policy advocacy includes the Bridges Coalition work, as well as statewide kind of culture change work, which we do a lot of with public education. Harriet Smith, who was mentioned, is Director of Education, co-director with me at BHRC. And so together we help to move direct services, public education, and policy advocacy work forward. In our direct services, I'll note I don't have all the numbers to share because 5 to 6 minutes, I want to keep it focused on overdose prevention sites. But I do just want to give a shout out to the amazing, amazing services team at BHRC and all the partners we work with, including Be More Power, BHSB, so many organizations, the SPOT team from the health department. We work and provide direct services across the city 6 times a week, giving out naloxone hundreds and hundreds of times. I can't even tell you. We are a syringe service program, and with the harm reduction services and supplies that we provide snacks, we provide coats, sleeping bags, tents, it is more than the needle, as we like to say. It is about that warm handoff. It is about, hi, I know you, I trust you. Please help me, right? Please help me to help you. And it's so, and let's work on this together, and let's talk about how we can make a more beautiful community together. So that is the work we do. That is our direct services. And I get really excited about it. And I'd love to talk to you all about it more. I'm not going to get into the details of this slide, but I am going to give this updated version of this presentation to you all so that you can see our definition of harm reduction for us all to kind of ruminate on. But just so we understand, when we're talking about overdose prevention sites, syringe services, naloxone, these are ways to end overdose and to end the drug war, which has failed, which is an upsetting, harmful system that has involved so many of us. Harm reduction works at individual levels, right, where we can give people naloxone and hope that they can use it with their loved ones, and various other supplies, fentanyl testing strips, etc. It also works at an institutional level, right? So we're talking about changing cultures. We're talking about shifting our understanding of what we need to do when we talk about safety and dignity and justice. And so I wanted to name all of that philosophically, because that's so important as we enter really controversial conversations like about overdose prevention sites. And given that this is a way to talk about what the work is that Baltimore City moves forward, we are proud to say that we work with Baltimore City agencies in a variety of ways. And those are listed here. We work on the opioid intervention team. As I said, we are a state certified ORP, so we have provided naloxone since from jump, just to say. And we are also an authorized syringe service program, also, I believe, the first community-based syringe service program in the state of Maryland. We are soon to be working with the SPOT program that Ms. Spencer mentioned earlier to provide broader healthcare services at our syringe service sites, which we're super excited about. And also, I had served on the mayoral transition team, proudly promoting overdose prevention sites with our mayor. So I'm excited to talk about that. So what is Bridges? It is a coalition that is dedicated to advocating for overdose prevention sites that we coordinate at BHRC. There are over 30 members, namely BHSB is one, Open Society Institute Baltimore, ACLU, Healthcare for the Homeless, IBR Reach, a lot of names that you're familiar with. Community-based organizations up through Chase Brexton, right? We're talking all sorts of organizations who are saying we need overdose prevention sites legally authorized in Maryland and specifically in Baltimore City. This is, Bridges actually was inspired by some research that had been done, inspired by community members saying we need to end overdose, and also inspired by research that was done at the Hopkins School of Public Health with Dr. Susan Sherman. This study is available. It's a cost-benefit analysis from 2017 on how much it would cost and save Baltimore City to have 2 overdose prevention sites in Baltimore. And so as you'll see, there's data around how much it would both save in money, but also emergency room visits, overdose response, ambulance calls, etc. So there's plethora of data out there that we are happy to share with you all. What are overdose prevention sites to Bridges? And I think this is important because the language on what these are can be manipulated in lots of different ways. Overdose prevention sites are indoor spaces where individuals can consume their own drugs in the presence of trained professionals. That includes people who are identified as peers, people who use drugs, really the folks that, as Councilman Dorsey had mentioned earlier, the people who are experts in the work, right? Trusted members of community with immediate access to life-saving interventions, medical care, emotional support, and non-judgmental therapeutic relationships. I've had the pleasure of visiting a couple of these sites actually myself, and I'm telling you, they are beautiful and they are life-saving. There are over 150 operating around the world. No one has ever died in an overdose in any of them. That's millions of drug injections and consumption events that have been saved, right? Now, the thing to remember is OPS do not replace treatment services. They are a crisis intervention. We are in a crisis and we need this intervention yesterday. They are positioned within the continuum of care to reduce overdose rates, right? That includes referral to services. It's not just hey, okay, here's naloxone, goodbye. It's here's naloxone, how are you? Can I help? Do you want coffee? Do you want to talk? Do you want to talk about Game of Thrones? Whatever. Let's just be together in community, right? That is what it's about. So for these years, what our work has taught us, it's all about what the community wants. We can sit here and talk about what these should look like and try to imagine them. But I'm telling you, after having hundreds, maybe thousands of conversations at this point about overdose prevention sites across this city and state and country, really, it's about what community members want. And they're saying yes on my block. That is our campaign. It's the Yes on My Block campaign that Ms. Brendelstein had mentioned earlier. We have a petition going out because one of the misnomers is that people are saying, oh, they're going to come out and say, no, I don't want this. I don't want this. We haven't actually come across that. What we've come across is, wow, that would be really amazing to have around here. We have the Pastor Simmons from Simmons Memorial Church in Penn North, Pastor Jim in Hamden from St. Luke's, Charm City Care Connection, all IBR Reach, all saying we would absolutely love to integrate overdose prevention into our existing services. That's what it's about. That's where people would go to it and how it would save lives. So we're saying adding new to the old because I want to ensure you all that remember Baltimore City was a premier risk taker in legally authorizing syringe services back in the 90s, y'all. It was a long time ago. And look at us. We're out here with over 20 syringe service programs across the state. Just think of overdose prevention sites as the next step. Because the thing with syringe service programs, they are amazing and they save lives. But it's so hard, having worked in our syringe service work, to say, here are your supplies. Okay, goodbye, because I can't actually be with you when you use and could overdose. How beautiful would it be to be able to say, like, actually, I'm going to create community with you in safety. So that is what overdose prevention sites are. No one has died in an overdose, and OPS could work with already existing programs and providers. There were questions about the policy stuff, right? That is my job, so let me tell you about that, and I know I'm probably running very low on time. We have worked with state legislators to present a bill at the state level 6 times since 2016. And you'll see this slide, the growth across the state. It started with one, as we call him, the lone wolf, Delegate Morheim, who had said, let's think about this. And then in 2020, when we were able to have co-sponsors on bills, we had 41 co-sponsors in the House and a growing number in the Senate. We have had over 11 bill hearings at the state level. They know the data. They're afraid of political risk, right? Which we get. So that's where we're asking Baltimore City policymakers to help be bold, right? Move forward to save lives. So I will let you know that there will not be, and this is now public, there will not be a state bill to authorize OPS in 2022. There won't be a bill presented because it is an election year and we know that it won't move forward and we need a minute, right? We all are very tired from the continuing overdose rates and we deserve to take a moment to sit back and say, what education, what ways can we push forward? One thing that excites us quite a bit is that Baltimore City policymakers, including our mayor and state's attorney, support overdose prevention sites very publicly, very, very much so. They have presented, Mayor Scott has provided testimony for the state bills. So we know that we can move forward in Baltimore, and our state policymaker champions know that Baltimore City has to move forward. So what we're asking of you all, and I know this is an investigative hearing, and I'm also asking something, please be bolder than our state representatives right now and say yes on my block to overdose prevention sites. Publicly document your support for overdose prevention sites to legally operate in Baltimore City and Maryland at large. City resolution, request for state action, whatever it is, please do it. An editorial in the Baltimore Sun. We need your public support. And the last thing I'll say is, I know for a fact that everyone is thinking of that one person or community association who you're thinking of, your constituents who are thinking, no way, I will tear you down. I understand that fear. Invite us to talk with them. We're really good at having controversial, emotional conversations. That is our job. So please invite us to have those conversations in your districts. Councilman Conway, I am in your district and I'd be happy to talk to you about it. I live off of York Road. And so let's do this. Let's have these conversations and use this next year for public education. And we're happy to support you all in being so bold. So please contact us. We are all over social media. We have a website. We also have video testimonials. If you go to our YouTube, which is BridgesTube, or you can just go to our website, bridges4ops.org. Thank you so much.
Rajani, thanks so much for your presentation, for your candor. And I'm pretty sure that myself and a lot of other council members not here and who are in attendance today are taking to heart what you said about us being bold. Thank you so much.
Thank you so
We are
much.
going to be moving into public testimony. Matthew Peters is going to start the public testimony. I know that some folks are here for another important hearing that we have afterwards. So if you get called on, just let us know that you're going to be testifying for the next hearing if you don't want to testify for this one. Matthew, you can take over at this time. Thank you.
Thank you, Madam Chair. Members of the public who have joined by computer, you should have a raise hand button. If you could please use that to let us know if you'd like to testify. You can also send a chat to me, Matt Peters, the host. I will start with call-in users. So we have a couple while waiting for anybody who would like to testify to use the raise hand function. First caller, you'll hear 2 beeps when you're unmuted in a second. Go ahead and start your testimony. Please state your name first. Third caller, did you have testimony? Okay. And we have hand raised, VM Millhouse.
Hi, my name is Michael Millhouse. Thank you for hosting this hearing today and inviting the public to speak. I am a community advocate, and in 2019, March, I got a phone call from my mom stating that my brother died from a heart attack at 11:30 p.m. and that his friends had dumped him out of the car on the street to die of overdose, in which he did die. So I lost my brother in 2019 to drug overdose. So this is very personal to me. I'm here also as an advocate for the trans community. I'm affiliated with Hearts and Ears, which is a peer-to-peer run behavioral or mental health facility that is also working addiction. So we do a dual piece there. And it's been in existence for over 25 years. I'm also a member of Faith Communities of Baltimore with Pride, and I run Element of Hope, which is a grassroots organization here in Baltimore that has a national reach that works specifically with the trans community with a focus on Black trans men, in which we did lose a Black trans man this year to overdose as well. He was the king of Pride. So again, this issue is dear to me, and thank you for having us. I have a question. How are we tracking the data in terms of opioid overdose or overdoses in general for trans populations? And there are many. So is there anyone tracking data, and how are we doing outreach to this population? But also, how are we making sure that our recovery homes and our outreach teams like Be More, Be More Power and Bridges are engaging these communities?
So, Mr. Millhouse, I want to let you know that this is a time for testimony. The public is not able to ask questions. However, if you place an email within the chat function, or if you want to email me at danielle.mccray@baltimorecity.gov with your questions, we will reach out and get those answered for you.
Yes.
If you have any additional testimony, go ahead and provide it. Again, if you want to send those questions to danielle.mccray@baltimorecity.gov, I'll get those questions answered for you.
No further testimony.
Okay, thank you so much for your advocacy, Mr. Millhouse, and for being here to testify today.
Okay, we have Aya Damons.
Hi, everyone. I'm Aya Damons, Baltimore Safe Havens Executive Director and Founder.
Baltimore Safe Haven is the only direct services program that's designed for LGBTQ individuals who are doing the work on the ground. Well, we couldn't ask questions, so I'm gonna kind of just put it in the chat because I was gonna start to ask a question, but I just noticed she just said that we shouldn't. We should put it in the chat. Matt, you did a great job.
Does not look like we have anybody else with their hand raised.
Madam Chair, I have a question for Rajani. Thank you. Rajani, I guess it's kind of a two-part question. Is one, is there any reason to believe that overdose prevention sites could or would come about in any sort of for-profit model? And if so, or other, regardless of that, I would say, is there any sense of like the size and capacity of what an overdose prevention site should have, or if there's something that's too big or whatever? And I ask this because, like so many of, I mean, we've all heard just totally stigmatized and kind of boogeyman kind of responses to the notion of treatment facilities of all different types coming into neighborhoods here and there. And I know there's one site that's been of particular contention in my district for a number of people. And in particular, it's a site where basically they've said we want to do inpatient, and if we can't do inpatient, then we'll do outpatient. And we're not averse to the idea of becoming an overdose prevention site in the future, should that become legal. Or and I don't even know if they've said that. I'm not certain. That may just be some speculation on the part of community members.
Council member, I hate to interrupt you.
So I'm just going
to comment. Rajani, if you can answer his question at this time.
Sure, absolutely. Thank you so much, Councilman Dorsey, for those questions. I think a couple things to remember is that harm reduction services, thankfully, giving out, doing syringe services, naloxone, those are free, right? So that is one of the reasons why we need to decriminalize paraphernalia, because there's actually no money to be made, because we are over 20 programs giving those services out for free. So when we think about overdose prevention sites, I would say, and I'm not going to get into medical insurance concerns because that will take us 8 years, but I will say that might be one thing that we need to kind of think about and talk through, right? Is what does the relationship with insurance look like? But the great thing about overdose prevention sites is that there are over 150 models, all of which are nonprofit, right? These are not for profit. So we can look to those. For how to design this, how to ensure that it's actually for the community and not any kind of scheme to make money. People won't use it if they don't trust it. I mean, this is in our city alone, granted the entire country, but our city alone having been so devastated and creating such a culture of fear around drug use, particularly in Black communities, we need people to trust these spaces, right? Which means we need trusting faces like folks who have been doing harm reduction for decades and years and are doing it now to be the ones operating these spaces. We need multiple options. We cannot just have one overdose prevention site in the city. That won't work. We need multiple all over the place.
Right? The chair wants to move forward. I just want to get to this other part of this question.
Sure.
Is the size and capacity of an individual place. Is there a site that's too big, or?
I would, and I think again, thank you for that specification. I think we need a variety of sizes, and probably there's always, when it's too big, it can feel uncomfortable for people, right? We want to make sure people feel comfortable. And the point you made earlier, I think, is what I want to draw to actually, Councilman Dorsey, is dignity. And what does dignity mean? It means for folks to have a space where they can go and have their own time and feel comfortable and not packed, right? And so that's where we don't want to create this oversized factory. You know, it's about creating a safe space for people. And so often that means it could be mobile vans up through just, you know, a room or multiple rooms, that sort of thing. So I know it's a vague answer, but I think it just has to have a lot of different looks and probably too big as possible. I just also want to name one thing that came up earlier very quickly around the federal concerns, is that we are working closely with federal or national organizations like the Drug Policy Alliance to work to keep the federal government from intervening on local jurisdictions. And there are ways to make that happen. And so I just want you all to know, in case there is that fear, that there is a lot of advocacy working to make sure that local jurisdictions like Baltimore City that move OPS forward will actually be protected. So I just wanted to name that too.
And Rajani, thanks so much for your response to the answer to your question. I have two more people, it looks like, who want to do public testimony. Councilman Dorsey, this is going into recess. We're not voting this out. And I would just express that you reach out to Rajani if you have any additional questions.
Appreciate it.
At this time, Matt, you're very welcome, sir. At this time, Matt, can you get back to public testimony? Thanks, sir.
Thank you, Madam Chair. We have Shane Couch Murray. Never mind. That her hand just went down. So we have Janae Tyler, and please note that as we are coming up on the next hearing, if you could limit your testimony to 2 minutes, the committee would appreciate it.
I actually don't have a testimony. I typed my question into the chat.
Thank you. Okay, and we have Shane Couch Murray again.
Thank you so much. Good afternoon, everyone. Shane Couch Murray. I am a social worker here at the Office of the Public Defender. I work specifically on the Comprehensive Opioid Addictions Program grant here. I just wanted to note that a lot of my clients that I work with are suffering from or experiencing substance use issues, and a lot of them seem not to know about the community resources that are available to them. And I wanted to bring light to that situation. And I also wanted to discuss like how I know it's not a question, sorry, but I wanted to bring light to that issue, and that's all.
Thank you for your testimony and just making sure that we understand that folks are not getting the information that they need. I just appreciate you for uplifting that and going on public record saying it. That's going to conclude our public testimony at this time on Resolution 21-0071R. I want to thank you to everyone who is joining us at this time. As I stated earlier, this is the beginning of a conversation. This is something that's going to be reconvened within the future so we can continue the conversation. At this time, the hearing on Resolution 21-0071R is now in recess. The committee will reconvene in the future for further discussion of the city's strategies and progress on this important issue.